Welcome, everybody. This, I have to tell you, it feels a little peculiar. Normally, we would be sitting in what we call our Libin Theater, which is a massive theater in the Cummings School of Medicine, and we can fit everybody in there, and it's welcoming and warm. And speaking to a screen right now, I have to say, feels a little strange. So I'm the dean of the medical school. I'm also, by training, I'm a gastroenterologist, and many of you may not know what a gastroenterologist is. For those who don't know, you probably don't want to know. This is not a career choice that inspires amazement in your family members. If you read on the internet all of the proctology jokes, well, that's me. That's what we do. It's a wonderful area. I guess the thing I wanted to share with you, though, is the opportunities that exist in healthcare fields. You are all embarking on a wonderful time of your life. You get to make some amazing decisions about what you could do and where you could go. And one of the things I would hope that you take from this is that the field of healthcare is one of the most broad and deep areas of future work that I can imagine. There is a spot for everybody in this. It almost doesn't matter what you like to do. There is a spot in healthcare where it fits. So whether you are a nurse, an allied healthcare worker, a neurosurgeon like our speaker, there is an opportunity anywhere. If you like to see patients, there are patient-intensive areas. If in fact you love healthcare but don't like to see patients, well, heck, there's also areas where that can happen. So it's almost anything that you want or matches you. Lots of great stuff to do. So I want to just take a moment and introduce Branavan, who's going to speak to you a little bit about his journey. And you'll notice immediately that Branavan is an amazingly smart individual. He trained at McMaster University, but then saw the light and came to Calgary. So Branavan is a wonderful neurosurgeon. He's what's called a Vanier Graduate Scholarship winner. The Vanier scholarships are tremendously important, and these represent the top tier of graduate students in North America, actually. So Branavan, I think, is going to share a little bit about his journey to get to where he is. This is a wonderful thing that I would encourage all of you to listen carefully to. So Branavan, thank you for doing this.
Great, thanks, Dr. Meddings. So I guess we'll start. And first off, thank you to the Canadian Medical Hall of Fame for organizing this and inviting me to speak. And more importantly, thanks to all the attendees and all the high school students. And hopefully throughout my talk, you'll see that it was really in high school that I kind of got started on where I'm at now. And hopefully that'll kind of motivate some of you to go along a similar path or find your own path. But the premise of my talk is that it's never too early to start dreaming or even making your dreams a reality. And we'll go through my path of how I got to where I'm at now as a neurosurgery resident here in Calgary. So for me, like I grew up in pretty low income housing in Scarborough. So Scarborough's in Toronto. It's in the east end of Toronto. It's where most low income housing is located. And for me, a lot of my childhood, my parents, my dad, till this day, works 2 jobs since the day he came to Canada. My mom travels about an hour and a half to work as a medical receptionist, filing charts. And my dad does manual labor and then works a second job working at a Metro, or it's similar to a Safeway here in Calgary. So, like by no means did I have anyone in my family who was a physician or a scientist. And I think hopefully my talk will let those of you who may feel like, I don't really know anyone in the field. How am I even going to get into med school? How am I even going to afford med school? Hopefully my talk will show you that, none of that really matters as long as you're willing to work hard and you've got, you're motivated. And I think that's the biggest thing. So for me, as a kid, a lot of my time was actually spent at our local church, mainly because they had a drop-in center. And since my folks were at work most of the time, I pretty much spent most of my time playing basketball with kids from my high school, or from my elementary school, St. Boniface, which is in the lower left corner, or sorry, lower right corner. And then we lived in the building up on the top left. And all of these spots were pretty much a 5-minute walk between one another. So I think for me, a lot of my childhood was spent kind of in recreational centers and interacting with people that by no means were privileged, but were definitely hardworking individuals. Next slide, please. And so when it came time for high school, I was pretty particular about where I wanted to go. And I went to a school called Neil McNeil. It was kind of it was by the beaches in Toronto. And again, it was an hour and a half of a trek for me. I used to take 2 buses and 2 subway trains in order to get to the school. Luckily, it was in my area though. And it was an all-guys school. And I know most high school students are like, oh no, why would you go to an all-guys school? And I think for me at that age, I was a pretty quiet kid. And it was nice to just be around a bunch of guys that didn't really care about what anyone really had to say about them. And it was just about, getting down to work, doing your work. And then sports were a huge, huge deal at our school. As you can imagine, at an all-guys school, sports were a big deal. And I had a lot of mentors along the way. And I think it was really in high school where the idea of mentorship really stuck. So one of my high school teachers, who I'm still pretty close with all of my high school teachers, actually. We still do a lot with the guys at our school, but the individual in the middle, Mr. Brady, or John Brady, he was my math teacher. He was also in charge of the the gifted program. By no means was I gifted. I did the test, and I guess the school board decided that I wasn't a gifted kid. So, for all of those out there who think that you're not gifted, I think those tests are pretty meaningless. And again, like, as long as you're willing to work hard, a lot of opportunities will be given your way. So Mr. Brady, he was like, hey, this kid's doing well in school. Why don't we get him involved in some of the extracurricular activities that we've got available? And so one of those activities was in grade 12. I had a couple cousins who went to that same high school, and they all graduated in 3 years doing night school and summer school. And I guess, I was kind of competitive in that regard. So I was like, if they can do it, I want to do it. So come grade 11, I had pretty much most of my credits to graduate. But my mom had put her foot down and was like, by no means are you graduating from high school. And I guess, I'm an only child. So part of it was my mom didn't want me to leave the house too early. And then the other bit was my dad had said, it doesn't matter. You can either go off to university or go to school or go back to high school, but you're not going off to work. And I guess my parents' fear was, if I started working, I'd lose interest in school. So I had all of the second semester of grade 12 off. So I was kind of sorting out, what can I really do for a whole semester? And often when we think of high school co-op programs, we often think that it's meant for the trades or something along those lines. And people often don't think of an academic co-op program. So I was pretty lucky. There's a neurosurgeon in Toronto, Dr. Michael Cusimano, who worked at St. Mike's Hospital. And he just happened to have a program where he connected with kids who were interested in doing something academic for their co-op. And also he had a special interest in kids that were coming from the inner city. So pretty much for my entire second semester of high school of grade 12, I was doing research with them. So I was going into his research lab every day. And then once a week, I would get to go to clinic with him and see some patients. And then every other week, I would get to go to an operating room and get to see him do surgery. And so, as a grade 12 student, learning grade 12 bio in the classroom is one thing, but then actually contributing to the research that kind of provides for the info that you guys learn in class was something totally out of this world for me. And then more importantly, getting to see what the real life of a neurosurgeon really is was just mind-boggling for me. So it really wasn't, it kind of, the whole idea of McDreamy, not that Dr. Cusimano isn't a McDreamy, but it kind of like, it really dispelled a lot of myths that I had. I got to see how hard he worked and some of the mundane things that he did that, you know, a lot of doctors don't talk about and don't share, that are just, you know, part of the job that we do. And then more importantly for me, Dr. Cusimano was a surgeon and a scientist. So I got to appreciate that, you know, for a long time, I thought maybe I want to do medicine and I want to go into medicine, but the idea of doing research never really appealed to me. One, because I never met a scientist, and two, I never knew what they really did until I met Dr. Cusimano. So his research was focused on, he had a few different interests, but the one I worked on was looking at specific type of tumor called pituitary tumors that are located kind of smack middle in the brain. And patients with pituitary tumors often come with symptoms of different hormone dysregulation. So they can seem very obese, but it's just because of a tumor, or they can have visual deficits because these tumors can push on the where the optic nerves cross. So I got to work with them looking at some of that cool stuff. And that kind of made me want to consider research and medicine as a career. So next slide. So by the end of grade 12 and before starting my university degree or my undergrad, I had already published a research paper. And I think, you know, in high school and in undergrad, we talk about currency, and the currency is your grades. Whether or not that's a good indicator of how good a student you are, I think that's debatable, and I completely agree that often it's not a good indicator of how good a student someone really is. But similarly, when it comes to research, the currency is how many papers have you published, or where have you published your papers? And again, that may not be the best indicator because there's a lot of things that go into publishing a paper, and being in the right environment and having the right project, and all of those things play a big role. But I was very fortunate to be in that right environment with Dr. Cusimano and be able to publish a paper right before I started my undergrad research or undergrad degree at McMaster. And so that kind of opened up a ton of opportunities for me, because often when we start in undergrad, a lot of students want to do research, but it's kind of challenging getting a research gig because you may not have the experience. So for me, I kind of had a leg up there. And then when we'll go to the next slide. And that's where I met the lady in the bottom right, Dr. Sheila Singh. So Dr. Singh, I met her in my grade 12 year while working with Dr. Cusimano. Dr. Singh was a final year neurosurgery resident at the University of Toronto at the time, and she had just finished her PhD during residency and come back for her final year. And her and I got paired up on a project together with Dr. Cusimano. And it just happened that that year when I was finishing high school, Dr. Singh was finishing residency, and she was being recruited to McMaster as a pediatric neurosurgeon and a scientist to open up a brain tumor research lab. And again, just serendipitously, I happened to be going to McMaster that very same year. So we ended up working together all throughout my undergrad, and I later stayed with Dr. Singh to finish my PhD, which I'll get into later. But the individual that I really want to comment on is Dr. Kalman Kovacs, who's in the top left. And so I met Dr. Kovacs when he was 72 years old, and he still works till this day, although he's retired, but he kind of comes in and out of the lab. And so all his research was on the pituitary gland. So the pituitary gland is this very tiny gland. And for his entire career, he's been studying the pituitary gland. And for me, he was kind of an inspirational mentor in that, you know, for your entire career, for like 40, 50 plus years, this one individual has been so dedicated to this one particular tumor and one particular gland. And he's kind of made groundbreaking discoveries, and our understanding of the hormones that are secreted by the pituitary gland are all largely thanks to Dr. Kovacs. So I think, you know, Dr. Cusimano kind of opened the doors, or I should say, in high school, I got the doors open by my teachers who kind of reiterated the fact that high school isn't a spectator sport, meaning that, you know, you don't want to be sitting on the sidelines. You want to get engaged, whether that's in clubs or sports or any sorts of extracurricular activities. And then that kind of opened the doors to Dr. Cusimano, who then introduced me to Dr. Kovacs and Dr. Singh. So you'll see a recurring theme that, you know, I've had multiple mentors, but it all, for me, started back in high school with that co-op placement. And we'll go to the next slide. And so, you know, this is kind of a montage of photos, but really what I wanted to iterate was, I've got a photo of me and my parents up in the top left, and that's when I got into med school. We had a white coat ceremony. So, you know, most immigrant parents don't often smile and don't usually tell you that they're proud of you. But I know deep down my parents were pretty proud in that photo. And I think the thing that I wanted to bring up was, you know, a lot of what we do in healthcare, we spend a lot of time in the hospital and with our patients and for our patients, but it's important not to forget the people that kind of have supported us from day one. And, you know, while my parents by no means were physicians, the work ethic that they kind of portrayed for me from day one is kind of what's motivated me to kind of keep working hard. And, you know, I see that in a lot of my mentors who are physicians now, but it all really started back at home. And then both Dr. Cusimano and Dr. Singh, it was kind of a fitting photo for me in that both my mentors came together. There was an award that I got from the American Association of Neurosurgeons at a conference, and it was just fitting that, you know, both of them were there. And, you know, I owe a lot of gratitude and debt to what they've done for me. You don't really see the photo in the top right there, but that was actually my landlord back from when I was a med student and an undergrad. And again, I wanted to reiterate the fact that mentors are everywhere. They don't necessarily have to be people that are in academic positions. You can have your landlord, in my case, was a mentor. That was me after having run my first marathon. My landlord paced me for the marathon. We ran it in Boston. And so again, it was something that, you know, I would have never thought that I would run a marathon, and lo and behold, it did happen. And I think the other big thing was that I wanted to reiterate was we spent so much time focused on academics. And I think especially at your stage in high school, it's really important for you guys to kind of also think about your wellness. I know there's a huge focus on wellness, and rightly so nowadays, which wasn't the case when I was going through high school. So developing healthy habits, whether that's taking time to go work out, taking time to just spend with friends and family and not be focused on your books all the time. Mind you, that's much easier said than done, but I just wanted to reiterate the value of that. And then lastly, that's the photo in the bottom left is my folks and my wife and I after I had my MD and my PhD degrees conferred to me. And then in the bottom right, you know, I definitely thought Toronto was the center of the universe when I lived there, but moving out to Calgary, I've definitely seen the light. And this was my wife and I, we got married on June 28th this year. And that was, we got married in Moraine Lake, we couldn't go to Toronto given COVID and whatnot. So, you know, like making lemonade out of lemons. And I think that's another important theme. Always think about how you can make things for the better, because there's always a way out to see kind of the light. And we'll go to the next slide. So I think the big things that I wanted to reiterate to everyone was, you know, dream big. You know, by no means am I supposed to be here. And I kind of always tell people that, like, you know, the odds were pretty much stacked against me in terms of getting to where I'm at. And, you know, I mentioned that money was definitely an issue for my family. And fortunately, I had a few scholarships that helped me out. I had the Vanier that Dr. Mettings had mentioned. And, you know, I definitely lived like a bum during my undergrad degree and lived in a basement apartment, didn't own a car, all of that. But that helped me pay off my med school degree without any debt. So, you know, most people can't say those things. And I think, you know, just having the upbringing that you might have, and also, you know, being mindful of what are the opportunities that I have and making the most of those opportunities. So that brings me to my next point. People may not necessarily hand you opportunities, but you definitely should go seeking them. So, when I was in undergrad, I would send out mass emails to professors, looking them up and saying, and thinking of ways that I could contribute to their research program. And, I probably sent out like 40, 50 emails, and maybe 2 people replied to me, but that was worth it. And I built relationships with those 2 people. So I think, by no means, just because you're in high school, do you need to feel that people may not give you the time of day. I think more often than not, people are excited to hear from you guys if you are willing to email people. And then I mentioned, mentors are everywhere. They can be your peers, they can be your relatives, and then they can be people in academic positions or your teachers and stuff like that. So, if you've got a peer who seems to really seems to have their stuff together, sit down, chat with them, see what they do. Those are things that I did. I kind of was in tune to the people that I looked at. And even as a resident now, I look at some of my co-residents and I see the things that they do. And I'm like, wow, how are they so functional at 6 a.m. when I'm pretty sleepy, and, chatting with them and getting ideas. So it's little things like that can go a long way. And people are often, pretty impressed that, you've been paying attention to what they do and you want to mimic what they do. So, imitation is usually the best form of flattery. And then the other big thing that I wanted to mention was, continue to persevere, welcome change, feedback, and lifelong learning. I think the big thing that I want to bring up is, welcome criticism. I think it's often, as highly educated as we might be, or as successful as we might be, sometimes it can be a bit challenging to get feedback, or when people might critique you. And often it's not what they say, it's how they say it. And sometimes feedback may not be given the right way, but always recognize that there's room for growth and accept that feedback. There's always going to be room for growth. And I think as long as you go into something with that mindset, by no means do you have it all figured out and you're there to learn. You're going to enjoy your time. And, even if someone has something negative to say, you're going to be able to brush that off pretty easily, knowing that, it's coming from a place where you can grow and learn. And then lastly, as I mentioned before, in terms of wellness, it's really important that you guys check in with yourselves, make sure that, you're doing things for the right reasons. It's really easy in what we do to get lost and, spend so much time in the hospital that you start to neglect yourself and your loved ones. And I think that's why it's so important that even at this early stage in your high school careers, I know if you're doing AP courses and things like that, those things can definitely take precedent at times. But it's always so important to definitely take a step back and check in with yourself and those that you care about to make sure that you're healthy mentally and physically, but also emotionally. And then next slide. So that's kind of my story and how I got to where I'm at. And then for the last few minutes, we'll quickly go through some of my research. So in terms of what is a stem cell, we think of 3 stem cells as cells that have this innate ability to kind of grow and reproduce themselves. So if a stem cell divides, it can become another stem cell, but it also has the ability to become a different type of cell called a progenitor cell, or even mature and become a more differentiated cell. So something that doesn't proliferate. So a stem cell can be a neural stem cell, and then a differentiated cell can be something like a glial cell or a neuron or an oligodendrocyte, which are the 3 different types of cells that we have in our brain. Next slide. So the human brain actually has stem cells, and that was a discovery made right here in Calgary by Dr. Sam Weiss. So for those of you that did not know that, Calgary has the claim to fame for discovering neural stem cells in mammalian or human brains. So Dr. Sam Weiss had, and these cells, they grow in these clumps, which are called neurospheres, which you see here that are green. They're not green in real life. They've just put a green protein in here so that they can see the cells. And then we'll go to the next slide. So when we think of cancer, Dr. Singh, my PhD mentor, during her PhD, she identified a rare group of cells in brain tumors called brain tumor initiating cells, or brain tumor stem cells. And so she used a protein on the surface of these cells called CD133. And what she found were the cells that had this protein in brain tumors had the ability to then proliferate or grow and self-renew or become new stem cells, and then give rise to some of the more common brain tumors like glioblastoma or medulloblastoma or oligodendroglioma. And in normal brains, these normal neural stem cells, or CD133 cells, are able to actually produce normal brain cells like neurons, oligodendrocytes, or astrocytes. Next slide. So this was kind of Dr. Singh's paper, and again, she found that these cells produce kind of these balls that you see on day 1 and day 4. Those are the CD133 positive cells, and the CD133 negative cells, or the cells that don't have that protein, weren't able to produce those balls or cells that grow in clumps. And then just on the right there, she kind of injected these cells into mice, and those are called xenografts when we inject cells into a mouse that doesn't have an immune system. So she injected them into the brains of mice, and those mice form tumors very similar to human tumors. And that's just shown by different proteins that she looked at. Next slide. And again, this just shows that these tumor spheres or neurospheres can grow in many different types of brain tumors. So whether that's medulloblastoma, which is a pediatric brain tumor, a melanoma, which has moved from the skin to the brain, or a glioblastoma, which is a tumor that occurs exclusively in the brain. Next slide. So I'll just walk us through a quick case of a patient that I saw when I was a an MD PhD student during my medical degree and my PhD. So this is a patient who, 12-year-old child, who came in initially with a 2-week history of vomiting and gait problems. Gait problems meaning he was just walking funny. He kept tripping over and stuff like that. And he's got this tumor in the bottom here. I don't have my mouse, but you can see on the left, and there's a MRI scan, and then that scan, that little circle ball is correlated with the tumor there. So next slide. So I'll go through Jamie's timeline just to give us an idea of, what was he going through. So he had his symptoms start in September of 2010, and then he had a surgery right away. He unfortunately had some weakness on the left side of his body. He ended up getting radiation and chemotherapy, and this is, a 13-year-old individual just about to start high school, and you can imagine how devastating that can be. Fortunately for Jamie, around 2011, he didn't have a tumor that we were able to identify. Next slide. And then unfortunately, just a few months later, in August of 2011, the tumor came back. He was still able to go back to school. He was elected his student council president. Unfortunately, a month later, the tumor kept growing. And then unfortunately, later on in December of that year, Jamie passed away. And I think, next slide, these are the things that kind of keep me up at night, seeing kids like Jamie. And at the same time, the reason why we see kids when he had a great surgery, the tumor went away, but this tumor came back. And that's something that, surgery alone or medicine alone isn't able to treat or solve. And that's where research becomes a huge component. So medulloblastoma is what Jamie had. It's unfortunately the most aggressive malignant brain tumor. And we've done a lot of interesting work over the past decade where we've started to appreciate that even though this tumor looks differently under the microscope, in the top panel, you can see 4 different pictures. Genetically, this tumor is also very different. We know that there's 4 different molecular or genetic subtypes to this tumor. And what we found out was this one type, WNT, W-N-T, these kids have the best prognosis. They have about 90% of these children live beyond 5 years, which in cancer terms means a complete recovery. So next slide. So what I wanted to show here was, even though we know these kids with Wnt have really good outcomes, it's much more complicated than that. And this just shows that, you know, on the left panel, on the leftmost side, that's the Wnt pathway. But this pathway interacts with all these other pathways going on in the cell. So just because we can stop or we can treat a child with a drug that stops the Wnt pathway, by no means does it mean that we can stop the tumor completely, because there's going to be interactions and crosstalk all within that tumor cell. And what we know is all these tumor cells are very different as well. So again, this just goes to show that surgery alone isn't going to solve our problem. Like, we'll have to do a lot of research. Next slide. So I'll just end on my PhD work, which we had published in Nature Communications, and we had quite a bit of media coverage for this work, because for the first time we showed that, you know, the idea that Wnt activation, so we always think of inhibiting cancer pathways or suppressing them as being the thing that we need to do. So we kind of took a different twist on it. We thought, what if we activated some of these cancer pathways? Could that be a good thing? And I mentioned earlier, the kids with Wnt activation have the best outcome. So what we did was we activated the Wnt pathway using some small molecule drugs in children, or not in children, in tumors from children, and grew those tumors in mice and treated the mice with Wnt activating compounds. And we saw that the tumors actually shrunk. And then we went back to some of these patients, and we saw that the patients that had high expression of these Wnt tumors actually ended up having good outcomes, even if their tumor wasn't a Wnt tumor. So, you know, there's 4 different types of medulloblastoma. So in the other 3 types, even if you had high levels of this protein, you actually had a really good outcome. So our theory now is we're starting a clinical trial where if we started treating some of these non-Wnt kids with a Wnt active drug, could we make their tumor smaller? And more importantly, could we reduce the amount of radiation that these kids get? Because it's the radiation that leaves these children with significant cognitive impairments. So, you know, it's great that the children live, but if their quality of life is not that great, then that's another big issue. So we're trying to minimize the amount of radiation that they get. And lastly, next slide. So I'd like to leave you guys with this note that, you know, a lot of students don't know this, but a lot of major stem cell discoveries have been made by Canadians. So Till and McCullough, who are Canadian Medical Hall of Fame inductees, were the first to identify stem cells. Dr. John Dick was the first to identify cancer stem cells. Dr. Peter Dirks was the first to identify brain tumor stem cells. Dr. Connie Eves was the first to identify breast cancer stem cells. And then lastly, Dr. Sam Weiss was the first to identify neural stem cells. So Canadians definitely have played a huge role in stem cell discovery. And then lastly, I just end with the same words of advice for you guys to, you know, dream big, seek opportunities. If you have many interests, find ways to merge them like I did with research and medicine. And then lastly, to always check in with yourselves and your loved ones.